My client is a massage therapist that took a workshop with me, and we're trading work. And I noted that on both sides her pelvis is extremely rigid. I can't take up the slack when I try and take up the slack posteriorly. So I'm pushing at it along the angle of my force parallels the anterior iliac shelf, and there's just no give whatsoever. And I'm pushing with at least 15 pounds of force, and I'm doubling that, not getting any movement. And so even with about 30 pounds of force, there's no give. And I know pounds isn't exactly a description of force, because you have to account for gravity, you know, so we could talk in terms of newtons, but for simplicity, I talk about force in terms of weight, because you can practice on a bathroom scale. So this is side glide of the pelvis, very, very rigid. I can't get any movement right to left. So let's have you lie on your stomach.
Okay.
And with her prone, the sacrum is prominent. If I come off the sulcus, I should fall, if I come off the PSIS, my thumb should fall into a sulcus called the sacroiliac sulcus. And in fact, I climb up onto her sacrum. So here's PSIS, and here's thumb on the sacrum. And this right thumb is higher towards the ceiling. So the sacrum does appear visually to be posterior. And I call this posterior glide, so it's a pure glide about an AP axis. And it's an unphysiological phenomenon. People who have this usually deliver a large baby, and it pushes the sacrum backwards when the pelvis has laxity from the hormones, or they fall onto their sit bones and it hyperflexes the trunk, and the weight traverses right through that SI joint and
that might
push.
be what happened, yeah.
You think so? That was a fall?
Yeah, well, because, I mean, I've fallen, I used to do, like, gymnastics and diving, like acrobatic sports, and I would fall on my behind sometimes, but I've never been pregnant or had a child, so.
Okay. And there's no inferior glide. There's no superior glide. If I try and spring the lower sacrum, there's no give with a reasonable amount of force. Now the sacrotuberous ligament comes from the ILA of the sacrum down to the ischial tuberosity. And that ligament is right here. And if I try and indent it, it doesn't move at all. So this ligament is very, very tight, feels like bone. And it would make sense that that be really tight with the sacrum stuck posteriorly. And I'm looking for the sacrospinous ligament, and it's the same phenomenon, being just very, very tight. I'm sure that you have rather good hip mobility. So here's hip extension, 20 degrees. Let's have you lie on your back.
Okay.
And looking at internal rotation, you've got excellent mobility, excellent external rotation. And let's do hip flexion. She goes above 90 degrees, very flexible. So we have a very rigid pelvis, but it doesn't impact your walking that much because you have very flexible hips. But if we watched you walk, we would probably see that there would be a lack of transverse plane mobility. With this pattern of a posterior glide sacral fixation, and that's the best model we have for it, no one studied it, looking inside the joint. That's very tricky research, and no one's done that. But our best model of describing it is as though the sacrum got wedged posteriorly.
Gotcha,
And
okay.
I mean, it could be that all the muscles are just really guarding significantly, but the treatment based on the biomechanical model frees up the mobility.
Okay.
So regardless of what it is, it affects the body and it affects function of the body. And even though there isn't research to guide me, my personal research, my personal clinical experience guides me. And I discovered this pattern and I developed treatment for it. And I've had some dramatic cases that respond to treating it.
Great.
What I can't show on the video is that your upper sternum is very rigid because the body compensates for this pattern by hyperextending up at about T3, T4. And so the third rib gets really tight with springing, and the upper cervical gets very tight in hyperextension at the OA joint. But I'm not going to demonstrate that with this camera. I'll just stop here and we'll treat you. It'll take me 10 minutes. We'll come back and we'll film the response.
Great.